Sometimes it makes me want to cry when a patient tells me, all of my life I thought I was stupid because I couldn't keep up with other people. I never knew that I had a problem, a real problem that could be helped. Well, ADD is a real problem that can be helped, and that's what I'm going to talk about in this video. I'm Dr. Tracey Marks, a psychiatrist, and this is part of a series that I'm actually going to be doing on attention deficit hyperactivity disorder, or ADHD. People will use the term ADD, which is the same thing. It's just easier to say, so that's what I'm going to say, but it really is the same thing. In this video, I'm talking about ADD as a bona fide neurological disorder. ADD is considered a neuropsychiatric disorder, which means it has both mental and behavioral manifestations, but it's also associated with malfunctioning neural circuits in the brain. We still don't know exactly the places in the brain where the circuits are malfunctioning, but we've seen enough evidence to conclude that there's definitely a disconnect between the way the brain functions in your frontal lobes and your posterior or back part of your brain. The frontal lobes are responsible for what's called executive functioning. This is stuff like planning, working memory, emotional control, and organization. The main cause of ADD is genetic. So if you have a parent with the disorder, it doesn't automatically mean that you will have it, but you have a greater risk of developing it. Another cause is what we call prenatal or perinatal insults, we call them. But these are things that can happen during pregnancy or even during the birth process. Some examples of this are things like cigarette smoking during pregnancy, using alcohol during pregnancy, or even having a traumatic birth that results in loss of oxygen. An interesting cause that I saw was maternal anxiety during pregnancy. Not sure why that's the case, but other things like infection, illnesses after birth, those are also associated with developing ADHD. So all in all, ADHD is seen as a problem that occurs during brain development, both before and after birth. Here's a study that showed that there's a 3-year lag in brain development in children with ADD. Kids with ADD have lower brain volumes until around age 16. So this is something real. It's not just bad behavior or laziness. I saw a parent of a college student who had been struggling most of her life in school, but by the time she got to college, it had become really bad and she was starting to fail classes. So I prescribed her medication. Her mother came to talk to me because she didn't believe her daughter needed to take medication to do well in school. She felt like she just needs to buckle down and get it together. Furthermore, she felt like this was something that we only see in America, and there's no such thing as ADD in her country. Well, my response was, your daughter has a problem, and you can either let her get treatment and thrive, or let her fail because you don't believe that this is something real and it's only for Americans. So her daughter took the prescription. She didn't immediately start taking the medication though, because she didn't have the support at home. She didn't feel good about taking it when her parents really weren't behind her on that. But after enough F's, she finally started taking the medication, and she told me that after she started taking it, it was like someone just turned on the lights. Completely different learning experience. So finally, she was able to attend long enough to take in the information, process it, and then retrieve it later when she needed it. And that's what a normal thought process is. But when someone has ADD, there's interruptions in that train of thought that make it hard for them to process information the way they're supposed to. I use this illustration because I think this is unfortunately the sentiment of many people. I think it's even more apparent when the main manifestation of ADD is hyperactivity. It's very easy to just look at that as a child without home training. ADD begins in childhood, and usually the symptoms show themselves somewhere around school age. You may notice hyperactivity in your toddler, But this can be hard to distinguish between variations in behavior at that age. So it'll become more obvious when the child starts school and there's more requirements with learning and more requirements with following rules. About 2/3 of children continue to have ADD symptoms into adulthood. The brain chemicals involved in ADD include norepinephrine and dopamine, and I'll talk more about symptoms in other videos. But broadly speaking, it's defined as inattention, hyperactivity, and impulsivity. These symptoms look differently in children than they do adults. In children, they usually show up as trouble keeping up with their schoolwork or having behavioral problems. Some children only have the attention problems and they're not hyperactive. With an adult, you can see frequent job changes, work problems, marital problems, more speeding violations and car accidents than you would with people who don't have ADHD. Stay tuned for an upcoming video on symptoms that look like ADD but aren't really ADD. Thanks for watching.